Thank you, Peter. So thank you all for being here today. I'm just going to start off with with acknowledgements. Peter's on the introduction. So starting off with the funders. So thank you to Alberta Labour and Immigration for funding this project through their OHS Futures program. And this is our research team. I just want to highlight two individuals. Siobhan Cardoso, our Knowledge Exchange Associate. This is a very stakeholder-intensive project, and she was really did a lot of recruiting and involving a very diverse group of stakeholders that made this project possible. And also Mumtaz Begum, put your hand up if you want to. Our research coordinator, who really tested herself outside of her qualitative expertise to not only be involved in scoping review and the qualitative analysis, as well as our ranking exercise. I'll mention what those all are, but also developed a workshop in Alberta, so a province outside of here, by herself, mostly by herself, so thank you. And lastly, our stakeholders, so really the crux of this project. So our stakeholders, we have 15 in total, who really lent their expertise and time to make sure that our findings are not only relevant to them, but hopefully relevant to workplaces in Canada. Right? I do have a caveat, and that these findings are really hot off my desk. Our team has had a look through the findings, but we would have liked to analyze these a little further before we present these in manuscripts and reports. So really, I stand by these findings as my own interpretations, and I absolve the research team of any criticisms that you might have. Okay, so it's on the title. What do I mean by an integrated approach? Well, essentially, it's building on this concept that the health and safety of workers is really just within the onus of occupational health and safety, and thinking more that wellness should also be considered in the overall health of the worker. And so it's really expanding upon the existing silos where health and safety are considered mandatory and wellness is often voluntary, and integrating the two by sharing resources, policies, and programs, and then really conceptualizing worker health as being a combination of health and safety and wellness. And what is not an integrated approach is simply adding a wellness program or simply thinking that individuals have dominion over changing their behaviors by themselves. Now, we've gone leaps and bounds from that way of thinking, and we're now seeing models such as the one on the right from Excellence Canada, which is really helpful in really helping us understand that there's lots of other factors in our environments, our physical environment, and in terms of workplace wellness, our work environment that can shape our behaviors. Now, this model in itself would not be enough for an integrated approach because while there's lots of definitions, an integrated approach really considers the role of work in terms of worker health as well. So it's not just simply telling people to take some resources and go home and change their behaviors, but also think about how work could be shaping the overall health of workers. And so what do I mean by this integrated approach in terms of examples? I wanted to give you some examples. And so if we think about a full day, if we work full-time jobs, we spend about 3/4 of our day at work. And with that, our working lives are inextricably linked to our non-working lives. And so if you think of examples where we spend a lot of our day at work, our behaviors also get shaped by what we do at work. And so our diets, our activities, also, there are examples where we have hazardous jobs at work, and then we have lives outside of work, which are also hazardous and often linked with those people who have the most hazardous jobs. So people who are the most obese in our societies, the people who have the most unhealthy behaviors, who smoke or drink, often also have the most hazardous jobs as well. We can also magnify our overall risks for health outcomes based on our lives at work and outside of work. So an example could be someone exposed to asbestos on the job is at risk for lung cancer, but then is also at higher risk for lung cancer if they're also smoking. So it just lends to this thinking that we need to be thinking more beyond our working lives when we're thinking of the overall health and risks of workers. So in support of this is a growing body of literature, and it says that by addressing health and safety and wellness, we're really taking on the overall health of the worker, and then it just makes sense that we're reducing illnesses and injuries. And so that's been starting to be shown in the growing body of evidence. And workers who feel that their organization cares about their overall health and well-being feel more satisfied at work. It has positive benefits on reducing absenteeism and presenteeism, and societal benefits in terms of reducing healthcare costs and having benefits in societies and families as well. So all good things, and it makes sense, but does it actually get taken up? Well, it's not a new idea, and I'm sure a lot of you have heard of this integrated approach in other forms or terminologies. And so in the US, it's referred to as total worker health, and there's a whole total worker health initiative and approach which has been promoted heavily by the National Institute for Occupational Safety and Health. And so there's numerous affiliates and centers across the country that are actively engaging in research to ensure that this integrated approach is not only taken up, but is as relevant and as useful for impacting safety, health, and well-being. There's also evidence across Europe, in Australia, in Victoria, and in Queensland. There's some guidance there, and I'm aware in Canada there's some mention of integrating health and safety and wellness to the Conference Board of Canada, as well as Alberta Health Services. So there are resources available, but it's, we wanted to see in the Canadian context, is it actually going on? And so we did the next best thing of actually surveying whether the integrated approach is going on with data that allowed us to see how often or frequently health promotion and occupational health activities were being implemented in Ontario. And so our hypothesis was that if there were a lot of health promotion activities with occupational health and safety activities, well, then there would be more opportunities for the integration to actually take place. And so we had data available from over 1,400 organizations in Ontario, and we just asked that simple question: how many health promotion activities are there compared to occupational health and safety? And we found that, unfortunately, there aren't too much of this co-occurrence of the two. So, probably not surprising. You see a lot of occupational health and safety activities on the x-axis, more of those, but on the y-axis, the plot is mostly skewed to the bottom, and so that's about 84% of all organizations that were surveyed. And then on the flip side, we only found about 15% that actually were modifiable, potentially modifiable to integrating, because they had health promotion emphasized in the same way that occupational health and safety were as well. And so it made us think that maybe in Canada, this hasn't really taken off and launched in the same way that it might be doing in other countries. And so there's some reasons for why this might be the case. Having looked at the literature, there's a lot of, it's a mixed bag of what this integrated approach can entail. And so a lot of it is just emphasizing wellness and how do you, bring in physical activity in the workplace? How do you increase healthy diets among the workforce? We're not really concerned with how do you actually integrate that with occupational health and safety and integrate those resources that are often focused on occupational health and safety. And so with the emphasis on wellness is also the issues concerned with wellness, which is attendance. And so a big issue with these wellness programs is attendance, getting people to actually engage and participate over a long period of time. And another criticism is that by emphasizing wellness and with occupational health and safety, it's just another way of employers shifting the blame of worker health onto the individual. So that's a common concern with this approach. And without much guidance, especially in Canada, we're not really sure how to implement it and what needs to be thought of when you're actually thinking about getting started. So just some examples of guidebooks. And I'm not saying that we're the ones to invent the wheel in this area, but that there is evidence on how you can go about thinking about an integrated approach. But these are not from Canada. On the left is from the US, and the middle is from Australia, and the right is from the US. And we find that they were very helpful, but also kind of missing some of our concerns of implementation, which is that a lot of them are based on ideal case studies of how organizations have already implemented an integrated approach and then learnings from them. But when you don't have many case studies to work with, what do you do? And in that case, you need to be starting to think about what are those barriers that we need to be thinking about to get people to do change. So our objectives were twofold. The first was to really get a lay of the land in terms of what are documented approaches to an integrated safety, health, and well-being approach. And so we did a scoping review. We tried to get a sense of literature in the last 10 years. We felt that that was really the crux of when things were really getting really heated in this area. And then second part is to use that evidence to inform our band of stakeholders who have experience and expertise in different aspects of implementation, and to really see what they think is relevant among these findings and what might be missing. And so we assembled a diverse group of stakeholders. A lot of them were based in Alberta simply because of the funding that we received from Alberta Labor Immigration. We try to get diverse groups of people who really spoke to worker and workplace concerns, so from health and safety, well-being departments, employee benefits, as well as leadership and research. And so with the scoping review, we followed a standard protocol of scoping reviews that we do at IWH, with heavy stakeholder engagement in forming the research question, as well as identifying any literature that we need to be thinking about that might not be available in our traditional electronic databases. And then we formed the question, which was, what are facilitators, barriers, and recommendations that are relevant to the implementation of integrated worker health approaches? Right? So we had a pretty high number of articles that we fetched initially, and we came down to about 59 articles. And so our search strategy was essentially identifying implementations of some form of occupational health and safety paired with wellness, and hopefully some outcome measure as well. Now, if those weren't available, we also looked at whether concepts associated with implementation were also mentioned. Interestingly, we didn't find any studies from Canada in our search, so it just made us feel like our research is more relevant here. So then with those findings, we had a stakeholder consultation workshop where we had everybody come together in a room in Edmonton, and we had flip charts at each desk. We had Mumtaz go around and record the conversations, and many moderate and can facilitate the discussions. And we just had everybody come together and really share their understandings of what we found, and also give us their perspectives as to what we might be needing to think about further. And so with that, we qualitatively analyzed the flip chart data and the recordings to really see if we can come up with common themes and buckets that really emerged from the discussions. And after that, we developed a preliminary framework which we felt really spoke to those themes. And then we fed that back to our stakeholders and then had them review and rate what they felt were of maximum priority and highest priority for them for implementation. So this is kind of a standard think, plan, do, check, or adjust management process, and we felt that it really fit nicely with what we found, and it had transferability with organizations because it's just so commonly used in management processes. So for those of you not familiar, the plan is really establishing objectives and developing a strategy for this implementation of this integrated approach. The do is the actual implementation. The check is then the evaluation, so seeing whether what you wanted to do is actually measuring up and happening. And then the adjusting is this idea of learning and continuously, iteratively improving your program over time. So we also felt that there was something missing in this, and we felt that timing was often brought up as important. And so we added a little pre-planned aspect to our model as well, which we felt was important to recognize before you think about implementation. And so, as I said, this is a process of continuous improvement, and The idea is that you're not expecting to get to meet all your objectives in one iteration, but that over time, through continuous adjustments and refinements, it's hoped that this program will meet the objectives you set out in the beginning. So the first question we asked, or one of the questions we asked was, how much time do you think, and how much resources would be required for an organization thinking of doing this? And so over 50% of time and resources were estimated to be in the planning and doing. And so that was really where our stakeholders felt needed the most involvement. And I'm going to present some parts of all the aspects, but there's just a lot to go through, and so I could probably take hours talking about each one. But instead, I'm just going to highlight some of the standout ideas that really, the themes that we found in each of these buckets. And so in dark green are ones that were rated highest, and then in lighter green are those that were rated highly, but not as highly as the ones in darker green. And so with the pre-plan, which is thinking of when the timing is right, assessing readiness was seen as important. And so assessing whether the organization is ready to go about change in the way that they usually do occupational health and safety, to also be thinking about wellness. And also assessing readiness in the political and economic landscape. And so if there is a certain tide of change where a particular outcome is seen as important, say mental health, it could be the right time to really emphasize a strategy where mental health is seen as a priority for the organization to address. And in terms of external economic climate, if there are funds available now for kind of cutting some of the costs involved with developing an approach, then that could be the right time as well. And also thinking about unionization. So if workers are unionized, thinking about what they might be, what their concerns might be when implementing this approach. And then the next step is getting buy-in. And so it's important to get buy-in from leadership. That's a no-brainer. Getting buy-in by letting the leadership know why this is an important approach, but also letting employees know as well. And with that, leveraging evidence of the benefits of this and to gain traction, to gain kind of support by maybe what has worked in the organization. Similarly, if, say, a wellness initiative had some success in terms of satisfaction or improving some outcomes. Also getting buy-in from getting leveraging data from external resources, from other community programs or from data. And identifying people who can really promote this initiative. And so identifying champions, people who are really, drank the Kool-Aid and are really feel like this is something that they want their organization to promote. And so identifying who those might be and really having them be vocal in convincing others that this is important to address. And then understanding needs and priorities. So our findings suggest that if you address needs and priorities that are important to workers and workplaces, it's more likely to drive attendance and traction. So this can be through conducting a needs assessment through focus groups, surveys, and getting a sense of what is important to people and what needs to be addressed. And then planning the strategy itself. So the planning isn't just limited to leadership. It's forming a committee of people who can share different perspectives. So leadership, as well as employees from different departments, from wellness, from health and safety, from human resources, and possibly even external members as well, people who have had some experience in implementing aspects of an integrated approach or unintegrated approach, and sharing their learnings as to what worked for them and what might not have worked for them. And privacy. So consider putting in mechanisms to ensure that workers feel that they're protected, that there isn't some other ulterior motive of workplaces in promoting such an initiative. And so really making sure that worker information is anonymized or held privately, and that their participation isn't being used for any other reasons. And communication, so tailoring the approach so that people can really understand their involvement and really consider that the different ways that people learn and take in information. It was also brought up to us that that might be the case for larger organizations. small to medium organizations, tailored approach might not be needed, and maybe a one message could really suit all. And then the importance of training, and so planning for change management. A lot of organizations will not have implemented wellness or will not have the resources in place at that time. And so it's really getting everyone on board and understanding where they fit into this approach. And so what they need to be doing, equipping them with the resources that they need in terms of engaging in the program, and considering adding involvement throughout the organization as well as involvement externally as well. And preparing the budget and resource requirements. So considering how existing budgets and resources can be used for this approach, as well as considering what additional resources need to be considered. And then measuring, so planning to measure. And so developing an evaluation strategy, thinking about what measures will allow you to see if your program is working. And so thinking about what is available in the organization or what needs to be considered as additional measures. If it's difficult to implement, then implement new measures, then maybe consider adding existing measures, such as if you have a customer satisfaction survey, maybe even adding to that and adding what people think about this new approach. And then the doing, so the implementation, ensuring leadership presence. So with leadership presence comes greater buy-in, comes greater a sense that an organization values this approach, and also ensures that leadership is also on board with what's happening, and ensure that that safety isn't compromised or diminished. So we were told that ultimately, if we address safety concerns first, if there are safety concerns, adding wellness before safety can actually go against participation. So it's important to address safety concerns first, and then communicate where the wellness really fits into the strategy. And on the topic of communication, ensuring that communication is effective in promotion. And so enabling those champions, those change agents, to have the tools, the resources to promote the strategy. And think about small wins. So we were told that building momentum early with short wins, say satisfaction, can then lend towards bigger wins, such as getting return on investment, or value on investment, or having impacts on health. And then decide on how you want to communicate the strategy. So decide what is meaningful to employees and how you will reach the most employees. So think about whether communication needs to change across departments and how the programs will be measured, as well as clarifying to employees, to the workforce, what is voluntary and what is mandatory. And then with the check phase, measuring and evaluating to see whether we are meeting the goals that you set out from the beginning, and consulting with leadership and participants as to how they felt while taking part or while developing the program. So this is all with an eye in terms of improving the program and adjusting it to actually eventually suit your goals. And communicating to leadership and employees, I kind of said this, so that they're aware of any milestones and successes, so you can really build traction, build kind of a sense that this program is worthwhile to continue investing in and engaging in the future. And then lastly, adjusting and revisiting and continuously improving. So revisiting the metrics, your evaluation findings, and seeing what aspects of the program need to be monitored, need to be changed, and how you can actually meet your loftier ambitions. So you've sat through all that, but this is really how it all fits together. And so this was all kind of developed with an eye that these are all meant to be high level, and that this isn't meant to be a one-size-fits-all strategy. We're recognizing that there are differences in organizations, that there are going to be contextual barriers as well. And so with this, the thought was that we would be able to provide people with high-level and best practice recommendations that people can really think about what are considerations that are useful before you actually implement something. And then with that comes refinement and tailoring. And so with next steps, it's hoped that with these recommendations we can really focus on specific contexts, so other provinces or other worker issues and health outcomes, and seeing really what is of value. And so with these recommendations, it's hoped that validation benchmarks can also take place. And so if there's a growing implementation, then organizations can start to think about what they need to be doing to really meet all of the best practices. And so it's hoped that we can transform these into benchmarks and something more tangible in terms of a checklist to actually implement. And I was really fast, but you have 30 minutes to ask questions. So if you don't get a chance to ask your question, feel free to send me an email or tweet at me as well. Thank you.
Okay, so we do have 30 minutes for questions, which is great. Are there any questions from the audience? Monique?
Abby, now that you've had a chance to look at those reports and you've got the data in, are there things that stand out that are complementary or quite different from the approaches that others have been talking about with the data that you got?
So the question is, are there any complementary findings or differences with other resources available? And so, yes, I think one interesting finding was in terms of incentivization. And so I found some of the other resources really focused on how do you incentivize workers. What we found was there wasn't really as much of an emphasis on that with what we found. I'm thinking that if you can meet employee needs, that is a big incentive. And so meeting needs is the big incentive, as well as getting leadership to buy in, and so that get organizational incentives as well. In terms of similarities, I think a lot of these really jive with what other places have found as well, other countries, other jurisdictions, and so there are similarities there, but at least with this, there's this underpinning Canadian contextual understanding, so I think it would be relevant here.
Just an add-on to that. So
Yeah.
you had a lot in your pre-planning that was interesting in terms of champions and understanding the culture and doing your homework before you even start. Do you see that also in the other resources as much?
So the question is, do you see champions and, this is just champions and promoting?
And the culture, understanding the culture, is it ready, is this the time? Do you see as much emphasis on that in some of the other reports from other countries?
Right, so do you see champions as being emphasized in other reports from other countries? Yes, so I think not only an integrated approach, but in general, health and safety and wellness separately, champions are seen as essential to promoting these activities, just because when you have those people who have really bought into something, that really transfers along to other people. People start to really buy into something. It applies a lot, even if you think about it just unrelatedly to just how we take in information. You tend to trust people who have positive experiences that you and you engage with them regularly as well. So I think seeing a face promote something is very important to getting something taken up. Yeah.
Shak?
Thank you very much. I'm curious about the kinds of wellness initiatives or programs that have been kind of integrated into the occupational health and safety programs, I guess, that you've heard from your stakeholder consultations or the data that you have looked at. If you need to give us a few examples of the common ways of integrating these, and what kind of wellness programs or initiatives are usually integrated.
Right, so the question is, what examples do you have of this integrated wellness and safety approach, right? It's a wild west.
Okay.
There's a lot out there. And so some of these are emphasizing, the traditional wellness, physical and mental wellness aspects. The ones that are really emphasizing the integration are really looking at what aspects of what we've traditionally thought about as wellness are taking place in the working world. And so I've seen a lot of literature out there around concerned with ergonomics and musculoskeletal health. I haven't seen as much as I'd like concerned around mental health. Some around physical activity, sedentary behavior. So a lot of physical initiatives, really looking at what workers are doing in their jobs. Some around the construction industry, so physically demanding jobs and addressing, say, occupational injuries and how those might vary based on, say, obese workers involved in those types of jobs. So a wild west.
Kim, did you
I did.
You
Thanks.
can ask a few questions if you want. All the
Thanks.
time.
Thanks. There were two things that occurred to me. So the first topic, I'm just going to ask you two questions, and depending on the answer, we might go a little further. So you'll be very familiar with the cardiologist in Ontario, David Alter.
Very familiar.
Very
He was
familiar
my
with David.
supervisor for my PhD.
So more than 10 years, about maybe 15 years ago, David took the initiative to bring a U.S. integrated health approach to Canadian workplaces. The brand of that initiative was called Intervent. Are you familiar with this?
Familiar with, not.
Okay. So if I could just sketch it, I apologize to the people online, because this won't come across unless you can repeat it.
Would you
So-
like to sit here and sketch it?
No. So you can, I encourage people to have a look on the web. Intervent is a compilation of evidence-based guides and assists for workers, employees, to use in the course of both their work life and their non-work life, with the hope of preventing either the initiation or the acceleration of chronic disease. That's the focus of Intervent. Very well done sort of guidance materials from the perspective of designed to enable adults to adopt behaviors and practices. So David's view was that that set of resources could migrate across the border quite easily. And he put a lot of effort into it. In other words, it's a resource that's available for employers to subscribe to and make available to the employees. He was of the view that could migrate across the border quite successfully. It didn't. And my question is, but I don't think you can answer because you're not familiar enough with the story, why didn't it?
Right. So that's an email to David.
That's an email for David. Okay, because that's always been a puzzle to me. And in a sense, it raises the question of, beyond your interaction with stakeholders about the sequence of steps to accomplish successful implementation, what are the barriers to getting to step one, which is to have the commitment that we're going to try and do this? Did your stakeholders talk about that?
So what are the barriers to actually get this up and running, to actually get interest?
Yeah, so like, from the perspective of sort of ordinally, are the barriers insurmountable? If you add them all up, are they insurmountable?
Right. And so our discussions with stakeholders were, I think that was the big discussion point, which was that how do you actually get this, I mean, this is a great idea and a lofty ambition, but how do you actually get this to be taken up? And I think that's why a lot of the discussions and a lot of the points were around the convincing leadership. And so I'm optimistic that what I've seen around Canada is that there is a lot of buy-in and interest in wellness. But I think we're often a little skeptical that this can be taken up. But it's about convincing with information, with data, that this is worthwhile being taken up. And so with NIOSH and Total Worker Health, there's a growing body of evidence now that this is starting to work. With David's findings, with different outcomes. David's findings with Intervent, it was a negative trial, he didn't find anything. And so maybe there were aspects of the development of the strategy, maybe it didn't really capture, a wellness approach, and the same way the integrated approach is promoting. And so it's really about finding what are those levers that can actually get change. And so I was optimistic with those discussions that, with data to convince organizations, people in that room felt like you could get buy-in, you could supersede those barriers. And what I'm seeing with Bell's Let's Talk Health, and with different chronic diseases coming up and showing up as being important for workers and workplaces, there is a sea of change. And maybe when changing from when David did his study to what we're finding now. And so I'm optimistic that that people are going to be on board with changing the way they do things. And it's just not as tangible as just saying we're not going to be able to do it.
Do you have a couple of questions? We have a couple online, and then we have 2 in the room, 3 in the room. Okay. Go, please.
So, Avi, do you have any examples of poorly implemented programs that were discussed and what the outcomes were of that?
I can't tell you. So the example, I don't have to repeat that, right?
No.
So I can't tell you that by hand. I can give you some examples of barriers, but I can't give you examples right now. But I'm happy to share that by email.
Okay, great, thank you. The second question I have from the webinar chat is the readiness phase, in the readiness phase, what did the expert panel list as examples of indicators of readiness of favorable external economic and political climate?
Okay. I don't recall any specific indicators, but I think the examples were given very anecdotally. Some of the examples were about an interest in from a political side for a particular focus, and so one was around mental health, and that if there's this interest from, say, a policy mandate that mental health needs to be addressed, that could be the right time to really, that there might be funding opportunities that allow organizations to consider investing in this, that might help them invest in this in an integrated approach. And so that's really what I've learned anecdotally. I don't seem to recall any others. I don't know if you have Mumtaz. No, I think that was really the example that was given to us. Yeah. But I can look through our findings from the review as well. I'm happy to share that as well.
Okay, thank you.
Okay. So we have a few in the room now. We have 1, 2, and then 3.
Hi, I'm from the Workers' Health and Safety Center, so I'm always coming from a labor point of view. Did you consider getting the buy-in of the unions as an important step in getting things started? Did you find that was important?
Yes, so the question is, did we consider union involvement and buy-in in our findings? Right? And so, yes, in our scoping review, that was mentioned in a lot of the studies out there that union involvement was very important. And so, because of in industries where safety is concerned. And then in our discussions where we were just front and center in terms of planning the approach, it was told to us that having unions involved in the planning and discussions and getting their sign-off first was seen as critical in those industries where workers are represented by unions.
Mm-hmm.
Yeah, thanks.
Yeah, I would think that they would tend to think that you're zeroing in on the individual, that their health and safety or well-being is like blame the victim kind of thing. So it would be really important to convince them that that's not what it is in order for them to support it.
Absolutely. Yeah, I agree.
I come from the development and implementation of safety strategies and the thing, and I just did the earlier question about bringing in strategies from other countries, specifically the States. I just wanted to know how you guys or the organizations were prepared to modify them to fit into the uniquely Canadian work environment.
Okay, so I think for us, it was really built into our methods. And so with our two-step process, it's understanding from the findings across the world what is relevant to our stakeholders. And so I think we tried to really pair that in. And so I should have mentioned the question, but the question was, how will we use the evidence from others, examples across the world as being relevant to the Canadian workplace, right? And so I think that was, for us, we were very cognizant of that in our approach. And so it's about getting that stakeholder perspective from our evidence, our review of the evidence base. And so we try to be very strategic in getting a broad group of people who speak to different aspects of the Canadian working world, and have them really talk to their own experiences. I think, obviously we might not have captured all Canadian workplace experiences, but I think this is an iterative approach where we have these recommendations out there, and then we get feedback, or we have our recommendations refined to specific Canadian workplace contexts.
Andrea.
Very interesting. I just want to know if you came across a Canadian company that does this. It's called Best Life Rewarded. Did you come across them in your scoping review or in your materials?
So the comment was, did I come across a Canadian organization called Canadian initiative called Best Life Rewarded in my review? No, I didn't.
So just a little bit of an introduction. They came here, some of you may remember, the founders of the company came here 7-8 years ago, and they presented to us. I helped them to develop some of the modules. It's an online portal, and they are associated with the Heart and Stroke Foundation, Canadian Diabetes Foundation, and Canadian Cancer Society, and they offer these services for companies. They have the portal, they do all the measures of the workers, and they offer this wellness. And I just checked the website, they say that they already reached 12,000 Canadian companies and 3.2 million workers in Canada. So it's a Canadian company. So you may be able to check for the.
It'd be useful to have a look at that. With our review, we were just really hoping that stakeholders would have identified this, but it wasn't identified at the time. It could also be that the way that we kind of developed our strategy was that we were really focusing on this health and safety with wellness. So I don't know how they've kind of described their initiative, but it could be that it just simply got off our, it was missed because we didn't see any focus on health and safety.
They offer, so what's interesting about this is that people who participate, like workers, they would get points for modules that they watch and change that they make in their life, and they can exchange those points for rewards.
Yeah, I think that's an interesting kind of approach. I think the way, this integrated approach has been kind of operationalized in so many different ways. And I'm just speaking for myself here, and that a lot of what we're seeing, what you're describing to me, sounds like kind of giving opportunities to people to do wellness activities in their home lives, or outside their work responsibilities. And so to me, kind of really defining this integrated approach is that the workplace itself needs to consider how it can be structured or changed so that it can benefit the overall health of the worker.
Thank you for your talk. It was really interesting. A question, actually a request. If you do email David, can we share the And my question is, in the construction industry, there's a lot of shift work, and people struggle just to stay awake and get the job done. How do you then implement something that deals with health and safety and wellness on top of that? It almost seems like a burden versus integration into the job.
So the question was an example of shift work where there's a lot of barriers in terms of engaging in a health and safety and wellness initiative. How do you address those barriers in the strategy? I'm not going to say I can speak to that. I'm not aware. I'm not aware of the details of an integrated approach geared towards shift workers. So again, with that email to David, I can also share maybe some findings if I can look through in more detail findings on the scoping review. Sorry about that. I
No
just can't
worries.
tell you right
Thank
now.
you.
We do have one more question online, and then I have one more just to
Of course, you
finish
yeah.
up.
So Abby, are you able to elaborate more on the types of initiatives that have been delivered successfully?
Yes, so the question is, well, I don't have to repeat the question, but I think it really, what we found was a lot of the findings that I presented as relevant to stakeholders seem to pair nicely with the facilitators that we found were important to implementation. And so successes was from getting buy-in by leadership and ensuring that that there is some kind of information base or database or important information to convince leadership that this is worth taking up, and also ensuring that the needs of workers and the concerns are being met while also thinking about how their privacy concerns are being met. So a lot of what I presented are actually very much aligned with what we found in the literature as well. Yeah.
Thank you.
So Abby, you said something today which really I think I hadn't appreciated up until just today when you had said it, which is around this challenge in this integrated approach about integrating voluntary and mandatory requirements of workers. And there's sort of the challenges around you need to be clear about, well, no, this you have to do this is mandatory, but you could do this, which is voluntary. And did anyone speak about the potential unintended consequences of people thinking things that are mandatory are now voluntary, or people thinking that something which is voluntary they actually have to do? And so, I guess, did people speak about that in terms of the integrated approach and how they overcome that, this mixture of mandatory and voluntary activities?
Do I have to paraphrase that? Or?
I've got it written down.
It's a good question. Again, I'm going to give you this unsatisfying answer that I can't tell you right now, and I have to look into it, just because of the volume of research we had to look through. I think it was brought up as a legitimate concern by our stakeholders. Not all of these concerns were backed up by an example, and so I can look into it, but I'm not sure I can give you an example. But it was seen as something that someone had experienced in the workplace as something that needed to be addressed, which is what is voluntary and what is mandatory.
Yeah, and it doesn't seem to be something that's commonly brought up in terms of how these things are implemented, from what I've seen. Would you agree with that?
I agree.
Yeah. Okay.
Yeah.
That's kind of interesting.
Makes sense. Yeah.
Faraz.
Thanks a lot. So since we have time, I thought I would maybe, building on, I think it was on your second or third slide about sort of some of the skeptics, or at least some of the concerns that come up. So I guess a couple of things that came to mind for me were who owns the data that we collect on sorts of work and non-work related factors like age, etc. I think about a New York Times piece this week or last week. They surveyed 200 economists, and New York Times found that 70% of them were in favor and recommended that health premiums vary as a function of your health behavior. So workers who engage in less healthy behaviors ought to be paid more, since they cost more for the system. So I'm thinking these sorts of wellness initiatives, who owns the data, and if it's employers, how much will their views differ from the average health economist, and how much will their views not? And the second question I have is, it could be a function of my, searching biases, but I've come across recently a fair number of randomized trials of wellness initiatives that show some impacts on surrogate outcomes, but virtually no effects on sort of non-surrogate outcomes, like effects on spending, effects on health behaviors, actually effects on others are not coming to my mind. But so I suppose on both counts, I'm just wondering, so are we putting the cart before the horse? Do we actually have strong evidence? Is it a function of what I'm reading versus what else is out there in the literature? Or are we putting the cart before the horse?
Right, good question. So I'm going to try to paraphrase the second question first. So there's been a few randomized control trials recently that have suggested that the outcomes aren't as successful, especially outcomes related to, was it health, I believe? I remember it was like risk, so surrogate outcomes being absenteeism, presenteeism, around that, and I think the health outcomes were also, and value on return on value on investment, right? I believe those were what those randomized controls really spoke to, and so the findings were not seen as statistically significant and worth really writing home about. So I think a criticism of those studies was that they were really focusing on very lofty outcomes with very short timelines, and so you can't expect to see improvements in the health of your workforce if you're only evaluating in 2 years. And so the view is that if you allow these things to take place over a period of time, you will see those longer benefits. And so those RCTs, because of the way they were designed, I don't think were really suitable for the outcomes that they were measuring. I read some of the commentaries around that. But if you look at some of the longer studies, they seem to be much more positive in what they found. Your first question was on who owns the data, and so it really, I think the push is that it's about being transparent. You can't. I think you would have to ensure that the data is housed somewhere where it's private and stored securely, and so if you are collecting data that is potentially seen as too private, say you're getting people to wear Fitbits and you're collecting the data and then you're seeing, and people feel like you're identifying the most sedentary workers in the workforce, that data needs to be housed somewhere securely. But it's about communicating clearly how that data is, what protections are being made to ensure that that data is being used in a responsible way. And so, these are all lofty ambitions, and we've really highlighted, high-level ambitions. But how this can be done, it really depends on the organization. But it's about communicating clearly to the workforce that it's being done properly.
Okay, well, I think that's probably enough for you, Abby.
I'm coming, send me your-
Okay, thank you.